Have you ever walked into a room and completely forgotten why you were there? Have you found yourself searching for a name you should know or rereading the same sentence because it just didn't stick? If you're over 50, you've probably wondered at least once, is this just normal aging? But what if the answer isn't as simple as getting older? What if one of the medications you take every day is quietly playing a role? Here's what's surprising. Some medications that help one part of your body may also affect memory, focus, or mental sharpness in some people, especially as we age. And one of the medications on today's list is so common that millions of Americans take it without ever suspecting it could have cognitive side effects. Another doesn't even require a prescription, making it even easier to overlook. So before you assume your memory changes are simply part of getting older, there's something you need to know. Researchers have spent years studying how certain medications can influence the brain, and while they don't affect everyone the same way, the connection is strong enough that many doctors and pharmacists now encourage regular medication reviews, particularly after age 50. That's exactly what we're going to uncover today. We're counting down 5 popular medications that have been linked to memory or cognitive problems in some people, explaining why these effects can happen, who may be more likely to experience them, and what conversations are worth having with your healthcare provider. You might even discover that the medication you'd least expect deserves the most attention. And there's another important twist that catches many people off guard. Sometimes the problem isn't one medication at all. It can be several medications, each causing a small effect that adds up over time until you start noticing forgetfulness, brain fog, or difficulty concentrating. That's why I recommend watching this video all the way to the end, because every medication on this list tells part of a much bigger story. Before we begin, one quick but important reminder: don't stop taking any prescription medication on your own based on what you hear today. Many of these medications are highly effective and essential for treating serious health conditions. The goal isn't to scare you, it's to help you recognize possible warning signs so you can have a better conversation with your doctor or pharmacist. Now, let's begin with medication number 5, a drug that millions of people use every year, yet very few realize it has been associated with memory and thinking problems in some individuals. Let's begin with a medication that catches many people completely off guard. Imagine this for a moment. It's spring, your allergies are acting up, or maybe you've had a few sleepless nights. Before bed, you take a common allergy pill or an over-the-counter sleep aid, thinking nothing of it. The next day, you walk into the kitchen and suddenly stop. Wait, why did I come in here? Later, you can't remember where you left your glasses, or you lose your train of thought halfway through a conversation. Most people laugh it off and blame getting older. But what if those two events weren't completely unrelated? That's why medication number 5 deserves a closer look. Many popular allergy medications and nighttime sleep aids contain an older type of antihistamine called diphenhydramine, the active ingredient in products like Benadryl and many nighttime cold or sleep medications. These medicines have helped millions of people manage allergies or get some much-needed rest, and for many people they're safe and effective when used as directed. But here's the question most people never think to ask. If a medication is powerful enough to make you sleepy, could it also be temporarily slowing down parts of your brain that help you think clearly? Here's where it gets interesting. Your brain relies on chemical messengers to keep billions of nerve cells talking to one another. One of the most important for memory and attention is called acetylcholine. You don't have to remember the name, just think of it as part of your brain's communication network. It helps you stay focused, learn new information, and remember everyday things, like where you parked the car or what you were about to say. Some older antihistamines don't just block allergy symptoms. They can also temporarily interfere with this communication system, which is one reason they may cause drowsiness, brain fog, slower thinking, or memory lapses in some people. As we get older, our brains often become more sensitive to these effects, meaning a medication that barely bothered you at 35 may feel very different at 65. Now here's the part that's often misunderstood. This doesn't mean taking one Benadryl for a bad allergy day is going to damage your memory or cause dementia. That's simply not what the research shows. What caught researchers' attention was something different. They began looking at people who used medications with strong anticholinergic effects regularly over long periods of time. In some studies, those individuals were more likely to experience cognitive decline than people who used them less often. An association doesn't prove the medication directly caused the problem, because many other factors can be involved. But the findings were significant enough that many doctors, pharmacists, and geriatric specialists now encourage older adults to review these medications carefully, especially if they're being used frequently. Here's another reason this matters. You may not even realize you're taking this type of medication. It might be in your allergy medicine, your nighttime cold medicine, or your sleep aid. In other words, you could be getting the same ingredient from more than one product without ever noticing. That's why reading labels and reviewing all of your medications with your healthcare provider or pharmacist can be so important. The good news is that this isn't about throwing medications away or stopping treatment. It's about asking better questions. If you rely on one of these medicines regularly, ask your doctor or pharmacist whether it's still the best option for you or whether a different medication might provide the same benefit with less chance of affecting your thinking or memory. Sometimes the answer will be to stay exactly where you are. Other times, a simple change may be worth discussing. The important thing is making that decision together with a healthcare professional. And if you think it's surprising that an over-the-counter allergy or sleep medication made this list, wait until you hear medication number 4. Unlike this one, it's prescribed for an entirely different health condition, and many people who take it never imagine it could have anything to do with memory until the signs become impossible to ignore. If medication number 5 made you look differently at over-the-counter medicines, medication number 4 reveals a completely different problem. Here's a question almost nobody asks when they pick up a prescription. What if 2 medications designed for 2 completely different health conditions were quietly affecting the same part of your brain? It sounds unlikely, but it's one of the reasons doctors have become much more careful about certain prescriptions as people get older. Take overactive bladder, for example. It's an incredibly common problem after 50, yet many people don't talk about it because they find it embarrassing. Frequent trips to the bathroom, sudden urges that are hard to control, waking up multiple times every night. It can affect sleep, travel, confidence, and even simple everyday activities. So when a medication finally brings relief, it can feel life-changing. Naturally, most people focus on how much better their bladder feels. They rarely stop to ask another question. How is this medication affecting the rest of my body? That's where medication number 4 comes in. Certain older bladder control medications, including oxybutynin, have been linked to memory and thinking problems in some people, particularly older adults. These medications are very effective at relaxing the bladder, but they can also affect the same brain communication system we touched on earlier. You don't need to remember the scientific details, just remember this. The pathway that helps calm an overactive bladder is closely connected to one that also helps support attention and memory. In some people, especially as they age, those 2 effects can overlap. Now here's the twist that many people never see coming. The biggest concern isn't always this medication by itself. Imagine someone who occasionally takes an older allergy medicine during pollen season, uses a nighttime sleep aid once or twice a week, and is also taking a bladder medication every day. None of those choices may seem unusual on their own. In fact, each medication may be completely appropriate, but together, they can place a greater strain on the brain's communication system than any single medication would alone. Healthcare professionals have a name for this: anticholinergic burden. It simply means the combined effect of taking multiple medications that influence the same brain pathways. Think of it like trying to have a conversation in a room where one fan is running. You can still hear each other. Turn on a second fan, then a third, and suddenly the conversation becomes much harder to follow. The fans didn't change the conversation itself, they made the signals harder to hear. For some older adults, multiple medications can have a similar effect on the brain's ability to process information clearly. This is one reason many doctors and pharmacists encourage regular medication reviews, especially after age 50. Sometimes there's nothing that needs to change. Other times, there may be a newer medication or a different treatment approach that provides the same bladder relief with less impact on thinking or memory. The important point isn't to stop treatment, it's to make sure every medication is still the best choice for your current stage of life. And just when you think the pattern is becoming clear, medication number 3 changes the conversation completely. It doesn't work through the same brain pathway we've been discussing, and it's not prescribed for allergies or bladder problems. In fact, millions of Americans take it every single day for an entirely different reason, yet many people never consider that it could be contributing to brain fog, forgetfulness, or mental sluggishness. That's where our countdown takes another unexpected turn. Up to this point, we've talked about medications that can affect the brain's communication system, but medication number 3 changes the conversation completely. This time, the question isn't, is my memory disappearing? It's something much more subtle. Why does my brain suddenly feel slower? Have you ever picked up your phone to do something important, unlocked the screen, and then just stared at it because you couldn't remember why you picked it up? Or maybe you've been telling a story to a friend only to lose your train of thought halfway through. You know the information is there, it just feels harder to reach. Many people immediately blame aging, a poor night's sleep, or stress. And sometimes they're right. But sometimes there's another piece of the puzzle that deserves a closer look. Medication number 3 is certain beta blockers, including propranolol, which are commonly prescribed for high blood pressure, irregular heart rhythms, migraines, essential tremor, and even performance anxiety. These medications have improved and in many cases saved countless lives. For millions of people, they work extremely well and never cause noticeable thinking problems. But here's something that surprises many people. Not all beta blockers behave the same way. Some are more likely than others to enter the brain, which is one reason cognitive side effects can vary so much from one person to another. Now imagine your brain is like a computer with dozens of browser tabs open at once. The computer isn't broken, it still works. But every click takes a little longer. Programs hesitate before responding. Switching from one task to another doesn't feel as smooth as it used to. For some people, that's one of the best ways to describe brain fog. It's not that memories suddenly disappear. Instead, the brain may feel less responsive, making everyday tasks require a little more effort than they once did. This doesn't happen to everyone taking a beta blocker, and it certainly doesn't mean the medication is harming everyone's memory. But some people report feeling mentally slower, more fatigued, or less focused after starting certain beta blockers. Because these changes are often subtle, they're easy to overlook. Someone might assume they're simply getting older, dealing with stress, or not sleeping well, when in reality, several different factors, including medication, could be contributing. Here's another important point that often gets overlooked. Brain fog isn't a diagnosis, it's a symptom. High blood pressure itself, poor sleep, depression, thyroid disorders, vitamin deficiencies, dehydration, uncontrolled diabetes, and many other medical conditions can all create a similar feeling. That's why guessing the cause rarely helps. The smarter approach is to notice the pattern. Did the symptoms begin after starting a new medication? Did they appear after the dose was increased? Or have they been developing gradually for months? Those are exactly the kinds of details your healthcare provider can use to determine what's really going on. If you ever notice changes like these, don't stop your medication on your own. Beta blockers are often prescribed to protect the heart, prevent dangerous complications, and improve long-term health. Instead, bring your concerns to your doctor. In some cases, they may decide that the current medication remains the best choice. In others, they may adjust the dose or consider an alternative if it's medically appropriate. The goal isn't to eliminate treatment, it's to find the treatment that gives you the greatest benefit with the fewest unwanted side effects. And now, we've reached the final 2 medications, and this is where the countdown becomes even more surprising. The next medication isn't taken for blood pressure, allergies, or bladder problems. In fact, many people only use it for a few weeks at a time, yet its possible connection to memory has sparked years of discussion among doctors and researchers. There's a good chance you've taken it yourself, or someone close to you has, without ever imagining it could become part of a conversation about brain health. Sometimes the biggest medical discoveries don't begin in a laboratory. They begin with doctors hearing the same unexpected question from patient after patient. Doctor, could my medication have something to do with why I don't feel as mentally sharp anymore? At first, those conversations didn't seem connected. After all, the medication wasn't prescribed for the brain, it was prescribed for the stomach. But as similar questions continued to appear over the years, researchers began asking one of the most unexpected questions in modern medicine. Could a medication used to treat acid reflux have any connection to long-term brain health? That's why medication number 2 on our list is proton pump inhibitors, or PPIs, including medications such as omeprazole and pantoprazole. Now, before we go any further, it's important to understand why this medication ranks so highly. It's not because scientists have proven that PPIs cause memory loss or dementia. They haven't. It ranks near the top because millions of Americans use these medications. Many people continue taking them far longer than originally planned, and the possible connection to cognitive health has generated years of serious scientific research and discussion. When a medication is this common, even unanswered questions deserve attention. Here's where many headlines have created confusion. You may have seen articles claiming that acid reflux medications cause dementia, but that's far more definitive than the evidence actually supports. Some observational studies found an association between long-term PPI use and cognitive decline, while other large studies found little or no increased risk. In other words, researchers are still working to separate cause from coincidence. That's exactly how good science works. It asks difficult questions, tests them repeatedly, and follows the evidence wherever it leads. So why are healthcare providers still paying close attention? Because there's another issue that's much less controversial. Many people start taking a PPI for a very good reason. Severe acid reflux, a stomach ulcer, or damage to the esophagus may require these medications, and in those situations, they can be incredibly effective, even life-saving. But somewhere along the way, weeks become months, months become years, and the medication quietly becomes part of the morning routine without anyone stopping to ask a simple question: do I still need this? Think of it like wearing a cast after a broken bone has healed. When the injury is fresh, the cast is exactly what you need. It protects the bone while it recovers. But once healing has taken place, leaving the cast on indefinitely wouldn't provide extra benefit. It would simply mean the treatment had outlasted the problem it was meant to solve. That's why doctors regularly reassess long-term treatments. It's not because the medication is bad, it's because the right treatment should match your current medical needs, not just the needs you had years ago. If you're taking a PPI today, this isn't a reason to stop it on your own. In fact, suddenly stopping these medications can sometimes trigger rebound acid production, causing heartburn to return even more intensely for a period of time. Instead, let this be a reminder to have an informed conversation with your healthcare provider. Ask whether the medication is still necessary, whether you're taking the lowest effective dose, and whether it's the right long-term plan for your health. Sometimes the answer will be yes, sometimes it will be no, but either way, it's a conversation worth having. We've now looked at medications that may affect memory through different pathways, medications that can add together over time, and medications that have raised important research questions because of how commonly they're used. But the final medication on this list is different from all the others. It isn't here because it's rare, it's here because it's incredibly common, because its effects on thinking and memory are well recognized in certain situations, and because many people never realize the connection until someone points it out. And when you hear what it is, you'll understand why it earned the #1 spot. We've reached the #1 medication on our list, and if you've been trying to guess what it is, there's a good chance you didn't expect this answer. Medication #1 is benzodiazepines, including medications such as lorazepam, Ativan, alprazolam, Xanax, clonazepam, Klonopin, and diazepam, Valium. These medications have helped millions of people cope with severe anxiety, panic attacks, muscle spasms, seizures, and short-term insomnia. For the right patient, at the right time, they can be extremely effective, but they're also among the medications that doctors have long recognized can affect memory, attention, and clear thinking, particularly in older adults and especially with long-term use. Think back to the last time you had an important conversation. Imagine someone pressing a pause button on parts of your brain while that conversation was happening. The words were spoken, your ears heard them, but your brain never fully stored them. Later, it feels as though the conversation simply vanished. That's one way benzodiazepines can affect memory in some people. Rather than erasing memories you've already formed, they can make it harder for the brain to create new memories while the medication is active. That's why some people remember feeling relaxed during an event, but struggle to remember the event itself afterward. Now, that doesn't happen to everyone, and it certainly doesn't mean that everyone who takes a benzodiazepine will develop dementia. But unlike some of the medications we've discussed earlier, where the research is still evolving, the short-term effects of benzodiazepines on alertness, reaction time, and the formation of new memories are well recognized in clinical practice. That's one reason many healthcare providers are especially cautious when prescribing them to older adults, particularly for long-term daily use. Here's something else that often surprises people. The medication itself isn't always the biggest issue. It's what happens when it's combined with other medications that also cause drowsiness or affect thinking. An older adult taking a benzodiazepine along with certain sleep aids, older allergy medications, or other sedating drugs may experience much greater effects than expected. That's why healthcare providers don't just look at one prescription, they look at the entire medication list. Sometimes it's not one puzzle piece that changes the picture, it's the way several pieces fit together. So what should you take away from everything we've covered today? It's not that medications are the enemy. It's not that getting older automatically means losing your memory. And it's definitely not that you should stop taking a prescription after watching a YouTube video. The real lesson is much more empowering. Your memory deserves the same attention as your blood pressure, your cholesterol, or your blood sugar. If you've noticed increasing forgetfulness, brain fog, or trouble concentrating, don't assume it's just age. Don't assume it's just stress either. And don't assume your medication couldn't possibly have anything to do with it. Instead, start a conversation. At your next appointment, bring a complete list of everything you take, including prescription medications, over-the-counter products, allergy medicines, sleep aids, vitamins, and supplements. Ask your doctor or pharmacist to review the list with one simple question. Could any of these be affecting my memory or my thinking? You might discover that everything you're taking is still exactly right for you, or you might learn that a small adjustment, a different dose, or a newer alternative could better fit your current needs. Either outcome is valuable because it's based on your personal health, not on internet headlines or fear. And finally, remember this. Throughout this video, we didn't rank these medications because everyone who takes them will experience memory problems. We ranked them because they're commonly used, because they're important enough to deserve informed conversations, and because understanding their potential cognitive effects can help you become a better partner in your own healthcare. The goal has never been to make you afraid of your medications. The goal is to make sure that years from now, you're still protecting one of your greatest assets, your ability to think clearly, stay independent, and enjoy the moments that matter most. If this video helped you see your medications in a new light, consider sharing it with a friend or family member over 50. One conversation with a healthcare provider could make all the difference, and sometimes asking the right question is the first step toward protecting your memory for years to come.